Welcome to this episode of Sleep Health under the Restonic Power of Sleep channel. I'm Dr. Bentley, and today we're going to be talking about restless legs syndrome. Now, this is a really interesting sleep disorder, and it's also one that's often overlooked, and partly because people who have restless leg syndrome often don't realize that it is a medical disorder and put it down to some kind of lifestyle event that's happening and which explains why their legs are feeling restless. But it's not. It's a neurological disorder, and so it needs to be taken seriously. And certainly, if you have it, you should tell your doctor about it. And as doctors, we need to ask our patients about it if they have sleep difficulties, because often, as I said, they don't realize that it's actually a medical disorder. So let's talk about restless leg syndrome. We're also going to talk about a disorder called periodic limb movement disorder. It's called PLMD for short, because it's a really long kind of title. It's a cousin disorder of restless legs and often coexists with restless legs. There are people who only have restless legs. There are people who only have periodic limb movements, but a lot of people have both. And what's really important to understand is that the restless leg syndrome doesn't necessarily stop once you fall asleep. Let's first talk about restless leg syndrome. The important thing about restless leg syndrome is that it's diagnosed on history. There's no real test you can do for it, but the history is so unique that if I talk to patients and I say to them, let me ask you these questions, if they have restless leg syndrome, they immediately identify with these questions. So these are the diagnostic questions that are out in the literature, these are the questions to use. So the first question is, do you have an urge to move your legs? Usually with an uncomfortable sensation. So let's unpack that a little bit. An urge to move your legs. Often I'll have patients who go, no, I don't really have that urge, but I can see them bouncing their legs. Okay, like, do you know how people bounce their feet? So, and I'll say to them, stop moving your legs, and what happens? And they'll stop moving their legs, and they'll sit there for a couple of minutes, and they'll go, no, I have to start bouncing again. And I go, that's the urge to move. So it's any kind of sense that you can't keep your legs still, that inside of you, you kind of go, I have to move my legs. That's the urge to move. And it can present, as I said, by people just bouncing their legs. Often it presents in the evening when you're sitting still. And if anybody is saying to you, listen, please sit still, like you're not sitting still, you may have restless legs and you need to ask yourselves these questions. So then it comes with urge to move your legs, often with an uncomfortable sensation. Now, the definition used to be about the sensation, but it's not anymore. It's more about the urge to move, because not everybody has the sensation. Now, the sensation you have with restless legs is obviously in the legs often, and it's an unusual sensation. So it's not the same as feeling cold or feeling hot or feeling pressure or feeling vibration, which are the usual sensations. So children are great. Children who have restless legs are great because they can think of amazing descriptions. So children will often come up and say that it feels like there's Coca-Cola in their veins. So they're feeling like a popping feeling inside their legs. Or they'll describe it as their muscles are pulling and stretching on their own. Or they'll describe it as ants running inside their bones. And when I give those descriptions to even adults who have restless leg syndrome, they often can identify with one of those sensations. What's common to all of those sensations is a sense of moving in the legs. So patients with restless legs describe that they sit there and they feel like something is moving in their legs and they have to move. So that's the first part of the definition, and it's a really important piece that you need to go, yes, that's what I have. The second defining question is, it's mainly at night. So this is tricky because if you've had restless legs for a long time, you may have it during the day as well. And then it's about thinking back to when it started. Did it start mainly at night? So it's either mainly at night or worse at night or only at night. But there's definitely a worsening at night. And I'll explain where that comes from in a minute, but that's part of the definition. So it's a nighttime thing. Third defining question is worse at rest. So if you're up and you're moving about, it really doesn't bother you at all, but it's when you sit still, either when you sit still to watch TV at night or when obviously you go to bed and now you're lying still and getting ready to go to sleep. So it's mainly at rest. The fourth defining question is that it's relieved by moving. And this is often a bit problematic because people assume that if you move, then it's gone. But it's not. What it's saying is that if you get up and walk, that your legs feel better while you're walking. If you stop walking, well, then you're back at rest and it starts again. So it is only while in the activity of moving that it will feel better. So let's go through those 4 questions again without all the explanation. So the defining questions for restless legs are that there's an urge to move your legs, often with an uncomfortable sensation. It is worse or only or more severe at night. It's worse at rest, and it is relieved while moving. And if you say yes to all 4 of those questions, then you have restless leg syndrome. That is the defining thing. What's interesting about restless legs is, as I said, it's combined with this other disorder called periodic limb movements. So where does that come from? If we take people who have restless legs while they're having it and we hold their legs still, which makes us incredibly unpopular, and they don't like it at all because they're just sitting there going, please let me move, please let me move. And we record the muscles in the legs. So the muscle we usually record is the front muscle on the shin, so the one that pulls your toes up. It's called tibialis anterior for those people who want the detail. And we put little electrodes on there and we record the electrical activity in those muscles. So this is when people are awake. They're experiencing the sensation of restless legs. What we find in that muscle are tiny little bursts of activity in the muscle that we can recognize as being electrical activity. And they happen about every 20 seconds. And so there's a gap, and then there's another burst in 20 seconds later, and then another gap of 20 seconds and another burst. And we can see this run of these little activities that are happening. Now, they're not movements because we're holding the leg still, so they're not actually moving. And that's the important thing. And when we see those little bursts of activity, that is what is causing that desire to move, or that urge to move, is a little electrical impulse in the muscles that's kind of going, move. Okay. When that happens during the day, so when that happens when we have restless legs and we see that little train of these bursts of activity about 20 seconds apart, we call those periodic limb movements of wakefulness. So they're while you're awake. So the periodic limb movement are these little electrical bursts that are happening about every 20 seconds. And the key important thing about these little bursts of activity is that when you go to sleep, they can continue during the night. And why that's important is because each of these little bursts can produce a disruption in your sleep, which means that your sleep can be cut into little 20-second bits, which means sleep tends to be very light. It's very easy for you to wake up every noise. You'll feel like patients often describe, they feel like they are just under the surface of sleep. They're not actually sleeping properly. Sleep is very light. And the next morning, patients can often wake up feeling tired, that they haven't slept properly. So if we see these bursts during sleep now, we call those periodic limb movements of sleep. And so that is why these 2 disorders, even though they're called completely different things, are linked together, because the underlying problem is exactly the same. But as I mentioned, you don't have to have both of them. You can just have the restless legs. You can just have the periodic limb movements. You don't have to have both. So let's look at why would we have these little electrical impulses? Where are these coming from? I mean, most people who have restless legs would consider that their legs are the problem, that is the source of the problem, but it's not. The source of the problem is actually in the spinal cord. It's at the base of the spinal cord, and everybody knows, I think, that the brain and the spinal cord all work on electrical signals, so electricity. And in this particular problem, the base of the spinal cord is more excitable than it should be. Now, the reason for that, and it's a bit of a complicated explanation, but I hope you'll follow me on that. The reason is that there's a pathway that comes from the brain down to the spinal cord. That pathway is bringing dopamine down, a neurotransmitter called dopamine, down to the spinal cord. And that dopamine acts as a brake to the spinal cord to kind of slow it down. Now, people who have restless legs do not have enough dopamine in that pathway. And so as it comes down the spinal cord, it kind of gives off dopamine to the spinal cord, gets to the bottom of the spinal cord, that area of the spinal cord that provides information to the legs, and has run out of dopamine by the time it gets there. So the brake is off. Not the whole brake, but a little bit of the brake is off at the base of the spinal cord. Now, you might say, why is there not enough dopamine? And that's a good question. If you have familial restless legs, what's happening in the brain is that there is a problem with the enzyme that's making dopamine, and it's making dopamine too slowly. And that's because of a problem with iron. So iron, the Fe2+, there's a problem with iron. Not that there isn't enough iron in the brain. There usually is, but it's just in the wrong place. And so this little enzyme that's making dopamine needs iron to work at its maximal free up capacity. And if it doesn't have iron, it works more slowly, and so the dopamine level generally is lower than it should be. Now, that is a problem, but generally not a problem during the day because the level is okay for what you need. But then as part of the preparation to go to sleep, everybody gets another drop in dopamine at night. Now, for me, that drop of dopamine does nothing. I don't feel it. Hopefully what it will do is, as dopamine drops, I'll feel a little bit more sleepy. But if you're prone to get restless legs, that second drop in dopamine now pushes you down to a level where there now is not enough dopamine. And so that base of the spinal cord is now excitable. And that's why it only happens at night, because of that second drop in dopamine that happens. So the base of the spinal cord is now a little bit excitable. So what it does is it kind of revs up. So the voltage, so literally it's an electrical signal, the voltage gradually gets higher and higher and higher. And when it reaches the correct voltage to fire the nerves, then those nerves fire. So it is a completely random electrical thing that's happening in the spinal cord. It is certainly not the brain causing a movement in the legs. It is random activity coming from the spinal cord. But you can understand that you'll reach the right voltage, fire the nerves, the voltage drops, but then it just increases again. And that's the reason for these little electrical bursts every 20 seconds. So you get a burst, and it takes 20 seconds to get up to the right voltage to fire again, and it drops again, 20 seconds to fire again. So it's kind of just a circuit that's running on its own, creating this electrical activity that's now going down to the muscles to cause this feeling of agitation, this feeling of restlessness that I have to move. So that's the basis of it. It's actually coming from the spinal cord. So let's look at who gets restless legs. There's, as I mentioned, if you have the familial version, there's a strong family history for restless legs. The numbers that we use is if we diagnose one person with restless leg syndrome, there's a 60% chance that someone in the immediate family also has it. I find often that it runs in genders. So it's all the girls in the family or it's all the boys in the family, but that's not an absolute at all. Obviously, if you have two parents with restless legs, then the children are much more likely to have restless legs. So it's not a purely genetic thing. It's familial. You have an increased likelihood of having it. If we look at the prevalence in the general population, like how many people actually have restless legs, for a medical disorder, it's actually extremely common. But it's different for different ethnic groups, and that's an interesting discussion. So in the European populations across the world, it's about 11%. The other group that's been analyzed quite well are the populations in the Far East. So that would include people from Japan, Vietnam, China, Korea, those kind of areas. The prevalence of restless legs in those populations is less than 5%. We don't know the prevalence in the other populations. There are some studies that have looked at it, but usually small numbers, so we don't want to use those numbers to say this is definitely how big the problem actually is. But 11% is quite common for a medical disorder. However, there are some situations where the prevalence, so that is how many people in a population have restless legs, is much higher. So let's look through some of those. So pregnancy is one of them. So in the last trimester, so pregnancy is divided into 3 bits. The last 3 months of pregnancy, the number of women who have restless legs can go up to 30%. And that is because of iron shifting from the mom into the baby, and so the mom is relatively iron deficient. And so because of a drop in iron in mom, they tend to get restless legs. Fortunately, most women who get restless legs in pregnancy, once baby's born and there's a couple of weeks later, the restless legs has gone. But restless legs is also higher in people who have damage to nerves in their feet, so whether it's from diabetes or excess alcohol or any kind of other cause of what we call a peripheral neuropathy. So there's a lack of sensation in the legs or just a drop in sensation, also about 30%. Patients who have renal failure who are on dialysis, 30%. Liver failure, increased amount in liver failure. So and obviously iron deficiency anemia, there's an increased likelihood of having restless legs. So all of these kind of things need to be excluded if you have restless legs. You need to check that you have none of those problems, because obviously solving that particular problem will relieve the restless legs as well. So that's the prevalence of restless legs, really, really quite common. So how is restless legs then connected at all to sleep? So the primary problem, let's deal with the two different disorders. So if we look at restless legs itself, the primary thing that happens with restless legs is a difficulty in falling asleep. Now, you can have restless legs if you fall asleep quickly. If you're one of those lucky people who can go to bed, switch off the light and fall asleep in 5 seconds, it's unlikely that the restless legs will bother you as far as sleep is concerned. However, if you're one of those people who goes to bed and likes to sit in bed and read and then, do something else and spend 15 or 20 minutes before you actually switch off the light, it is likely that within that time the restless legs will start, and then it's really hard to fall asleep because you can't move your legs and fall asleep at the same time. And patients with restless legs get into this difficulty where they move their legs kind of up and down the bed and the restlessness has gone, and then they stop moving, and then they know they have 20 seconds to fall asleep. And I don't know if you've ever tried to fall asleep on an agenda, I have to fall asleep now. Tends not to work. And so within 20 seconds you can feel those legs coming back again and you have to move. So often they'll present with difficulty falling asleep. And that's the main thing that occurs with the restless leg syndrome. If we move on to the periodic limb movement disorder of sleep, what that tends to do is it fractures the sleep, so the quality of sleep is extremely poor. So you may sleep through the night, but wake up in the morning and know immediately that you've woken up, that you are tired, that you don't feel refreshed, and that there's been a problem with the quality of sleep. But the periodic limb movements can also wake you up during the night. So often we'll find that patients will sleep 3 or 4 hours and then wake up and then have restless legs in the middle of the night and then have great difficulty going back to sleep. So that can also present like that. So any reason in the morning where you go, my sleep was disrupted, it was very light, I don't feel like I've rested, that would be, we would kind of suspect that you had the second disorder of periodic limb movements during sleep. Now, we mentioned that restless legs can be diagnosed on history. Periodic limb movements, if there's no restless legs, can only be diagnosed in a full sleep study that occurs in a sleep laboratory. There are a lot of sleep studies that are done, as I've mentioned before, that are done just for apnea, and they're done at home, and all we do is measure the respiratory channels. But when we're looking for leg movements, we have to do it with a full recording in a facility. And we can find them quite easily because they're there, and then we look at how severe they are. So the periodic limb movements, under 5 per hour would be considered normal, but I certainly have patients who have 25 of them per hour, and you can understand how much that would fracture sleep and how much that would cause waking up feeling tired and a tired or sleepy feeling that occurred during the day, which then interferes with the work that they want to do. So that's restless legs and periodic limb movements. It's really an interesting disorder. So what are we going to do about it? So it's all very well to talk about it. How do we treat it? Well, firstly, let's talk about things that might make it worse, that you might be doing, that are actually making the whole problem worse. So, and this is not consistent. So some patients will describe these as making them worse, but other patients won't. So for example, caffeine. Some patients describe that if they do have coffee later in the afternoon, for example, that their restless legs are much worse at night. So caffeine can aggravate it. Exercise can aggravate it or relieve it. Again, this is a very personal thing. Some patients will say to me, if I exercise a lot in the morning, then I'm fine and the restless legs are better at night. Some patients prefer to exercise at night because that relieves it and they feel better. Other patients find that there's a line for exercise. As long as they don't do a lot of exercise, they're okay. But if they do a lot of exercise, then that actually aggravates the restless legs. So it would really be for you to figure out how exercise and the caffeine affects your restless legs and whether that's an option to help you manage it. Other things that may aggravate it is sugar. So some people find if they go out for dinner and have a really sweet dessert that also aggravates restless legs. There really is no good, recognized, recommended, trialed, non-medical treatment for restless legs. So there are lots of people who say, oh, if you use crystals or if you use copper bands or if you do this or you do the next thing, there's nothing really documented that works well consistently in everybody. Even magnesium, kind of calcium, doesn't really work for restless legs. It does work for leg cramps, and it's important to recognize that cramping at night is very different to restless legs. So cramping, where the muscles of the calf usually are contracted and tight, and it's really painful, and you have to kind of pull the muscle and stretch it and wait for that cramp to go away. That is not restless legs. That is leg cramping. And that does respond very well to calcium, magnesium, zinc kind of combinations in supplements. So that's not restless legs. But there are a bunch of medications that can make restless legs worse. So, for example, antihistamines. Now, the important thing about antihistamines is that if you get medication over the counter to help you sleep, they're likely to be antihistamines. And so you can get caught as someone with restless legs, if the restless legs is affecting you being able to fall asleep, and you go get something from the pharmacist to help you fall asleep, that is likely, if you don't get a script, that is likely to be an antihistamine, but that can make the restless legs worse. So you might get caught out by that. Then, honestly, every single antidepressant can make restless legs worse, but often doesn't. So when we say it can make, we're talking about a small percentage of people who would take the antidepressants. And the other thing that can make it worse is the antipsychotics. Again, the antidepressants and the antipsychotics are both medications that you may get from your doctor to help you sleep. So again, you might be caught in a bit of a trap here that what you're trying to take to help you sleep is actually making the restless legs worse and making your sleep worse, not better. So really important to look at if your restless legs have got worse, to look back and say, when did they get worse? Did I start any medication at that point? Did I change my lifestyle at that point? What did I do to make the restless legs worse? Unfortunately, maybe nothing that you did to make the restless legs worse. You may have just got older. So certainly we know that as you get older, you're more likely to present with restless legs. And so it may just have been that. So there may not be anything, but please check any new medications you were put on, and that maybe you can have a different medication to treat whatever you need to be treated, not that particular one which may be making restless legs worse. So patients will often come to me with restless legs and I'll say, what have you tried? So what have you tried to manage the restless legs? I've given you the diagnostic criteria for restless legs. There's a lot of circumstantial evidence for restless legs that patients will talk about, and they'll say, well, I have these, and I'll ask them questions about particular things. So let's talk about the circumstantial evidence for restless legs. So patients will say that I sleep better if I put a pillow between my legs. And I go, why do you put a pillow between your legs? And some people do that because of back pain, and that's absolutely valid. But patients with restless legs will say, I can't have my legs touching. My legs feel irritated, and if they touch, they feel awful. And I'll go, that's restless legs. Your legs shouldn't be that irritable at night. Okay? So putting a pillow between your legs. Patients will say, I leave cold water in the bath so I can get up and put my feet in cold water and then they feel better. Or they put them in the swimming pool. Or they'll get up or they'll put their legs up on the wall. Or they'll bend their legs up. So positional kind of trying to make the legs better because you're doing different positions. So cold. Patients with restless legs will very rarely be able to tolerate socks on their feet. So that they can't do. So they'll have all of these kind of tricks that they're trying to manage the restless legs with. I always say my kind of slam dunk question for restless legs, if people are not sure if they have it, I'll go, okay, overnight flight, and you're in the middle seat on the plane, and they will literally look at me with horror, say, please don't do that to me. And I go, why not? Why can't you have the middle seat? And they go, I have to get up and walk. I have to do that. And I go, that's restless legs, right? You should be able to sit still for an overnight flight. And so it's those kinds of situations where you kind of put people into those situations and they go, oh no, I can't do that. I can't sit still here. What happens if you go to a movie or a theater and they go, I have to sit on the aisle because I have to keep adjusting and moving my legs around the place. So those are kind of circumstantial evidence for restless legs. But what patients with restless legs will say to me is that I sleep better on a painkiller than I do on a sleeping tablet. So many of them have tried sleeping tablets, whether they're the benzodiazepines or the antidepressants or the antipsychotics. They've tried sleeping tablets because they really cannot sleep. And if you're in a situation where sleeping tablets tend not to work, then you really have to look at whether there is restless legs there, because they tend not to work. However, painkillers, particularly those painkillers that have some codeine in them, so we're talking about Genpain, Stilpain, Miprodol, those kinds of painkillers, often work well because we know that codeine treats restless legs. Now, it's useful to use those kind of products for an emergency, so such as an overnight flight, but it's not something that we would recommend at all to use every night to treat restless legs with. But we know it works. Certainly patients who have very severe restless legs where nothing else works, we do sometimes manage them with codeine, but obviously very, very carefully. So for an emergency, or for those people who don't actually have bad restless legs, but get put into a situation like an overnight flight and then have bad restless legs just for that night, taking one of those painkillers before the flight, you often find you're able to sit still, and it works quite nicely. The other thing that works well for restless legs is cannabis. That's full-blown cannabis, not CBD oil, not THC. There's something else in cannabis that works well for restless legs, but it is also something that we cannot recommend as a nightly thing to do to manage the restless legs, because the problem with cannabis is that it does affect your sleep badly. So it reduces the amount of deep sleep that you have, it reduces the amount of REM sleep that you have, and over time it's very difficult to come off it to be able to manage the restless legs. But it does work. And so patients may have tried it, and I will always ask patients if they've tried it. They will look a bit horrified and go, "How did you know?" And I'll say, because it works. And so often patients who get desperate will try all kinds of things, including cannabis. So those are the kind of things that patients might have tried before they come for help. There are 3 medications that are registered and recommended for restless legs. They are not sleeping tablets. They're not actually going to affect sleep at all. All they do is stop the legs from moving, and then the natural sleep can happen. So it's really taking away an interference to the natural sleep, and then normal sleep happens. So obviously you might have figured out from my explanation that if we give patients dopamine at night, so if we increase the dopamine level at night, that would probably work. And it does. So it's one of the products that we use is not replacing dopamine, but giving a product that acts as if it is dopamine in the brain, increases the dopamine level back to normal, and the restless legs settle down. There are some side effects to that medication. It used to be the first-line medication that we used. It's not the first line anymore, but it is still very useful. And certainly, if you're on a product called either Pexola or Oxpola or Requip or anything like that, please stay on it if it works well for you. There are some side effects which, if you're on Pexola and you haven't had that, you're not going to get it. So please don't worry about it. But some patients who start Pexola do get compulsive behaviors. And that's because dopamine is also used in the reward circuit in the brain. And that little circuit is what every illegal drug works on. So whether it's amphetamines or tic or cat or cocaine or crack or anything like that, they all work on the same circuit, and that's to give you a bit of a high. And sometimes, in very few patients, this product hits that circuit. And so I have hundreds of patients on Pexola and Oxpola because that's what we used to use. And I have 5 patients out of all of those patients who've had these side effects. So 2 male patients of mine got compulsive gambling, and 2 female patients of mine, or 3 female patients of mine, got compulsive eating. And it was very clearly linked to the medication. So really from the second day they took the medication, they phoned me up and they said, "Listen, I am having this thing." And I went, "Stop, please stop taking the medication." So then we use the other medication. So that's all that happens. But particularly with these medications, I think the reason why they've shifted out of being the favorite is because in a significant minority of these patients, so we're talking 30 or 40% of patients who are taking these products, particularly if they're taking high doses of these products, we get a thing called augmentation. And what augmentation is very specific to restless leg syndrome. Even if you take these medications for something else, such as Parkinson's, you don't get it. Specific to restless legs. And what this looks like, and it's really important because you may be on Pexola and having these kind of problems, and it's really important to know what it is. So augmentation happens when you're taking a dopamine product, and the restless legs comes back. And so you tend to increase the dose that you're taking, but the restless legs comes back a little bit later. So you increase the dose and the restless legs come back. And you seem to be constantly chasing the restless legs by continually increasing the dose. That's not normal. Usually patients who go on these dopamine products, we find the dose and the dose is stable, obviously for the rest of their lives. They just stay on the same dose. So if your dose is gradually increasing by weeks, there's a problem. That's called augmentation. You need to come off that medication and you need to move on to the other medications. The other two medications we use, you don't get augmentation with. They work at a completely different level. So the first target that we have for treatment is to target the original problem, the lower dopamine, replace the dopamine, and that works extremely well. The recommended medication currently is not that. It's actually medication to tackle the spinal cord. Remember, I spoke about that the spinal cord is hyperactive. It's kind of winding up and creating excessive voltage within the central nervous system. And so we use medications that really are designed to bring that activity back down, to actually put a little bit of brake onto the spinal cord and stop the activity. Now, what's interesting is those two products are products that we use for something called neuropathic pain. Now, there's two types of pain. There's nociceptive pain. That's the one I think we all know. Pain receptors. If you bash your elbow, it's sore. Exercise too much and there's pain. You take an anti-inflammatory. This type of pain is different. So this is pain coming from within the spinal cord or within the brain. So it's not pain receptor driven. It's the fact that neurons are too active and the brain is perceiving them as pain. So an easy example is if you have a slip disc. So if you have a slip disc in the back and the disc slips out, what it does is hit the spinal cord directly. There are no pain receptors there, but it damages those neurons and that damage is perceived as pain in the brain. So we use products that are used for that because actually restless leg syndrome is actually a form of pain and runs in the pain pathways, which is why codeine tends to work and why dacha tends to work, because they work in the pain pathways as well. So these products, so the one product, I'm giving the original names for the products. The one product is called gabapentin and the other product is called pregabalin. In South Africa, that's epileptin and Lyrica, so if those names make sense to you. But in other countries, they may be called other things, but gabapentin and pregabalin. They work in the pain pathways, and we get excellent results if you use those products for restless leg syndrome. So obviously speak to your doctor if you feel you have restless leg syndrome. We only treat restless leg syndrome if it's causing other problems. So if it's affecting your sleep, if you are either battling to go to sleep or you are waking up tired in the morning, then that's a reason to treat. If you have restless leg syndrome, which is mild, it's just a minor irritation, doesn't affect your sleep at all, there's no reason to treat it. It's not as though restless leg syndrome is going to turn into something worse later on. It's not. It is just it. So we don't treat unless there is a reason to treat, and that is we want to improve daytime function during the day because you're feeling sleepy or you're unable to fall asleep at night. Then we would treat the restless legs. Obviously, we want to treat the lowest dose possible, which is why we worry if the dose is escalating and we need to get patients off that medication and put them onto some other medication. So what's really important is if you identify with those symptoms of restless legs, please go and speak to your doctor about that. If they can't manage it or they don't have experience in managing it, they will know who to send you to. But please get treatment for that, because if it's causing sleep problems, nothing else is going to work. No sleeping tablets are going to work. No other medication is going to work except the specific medication for the leg movements. So that's restless legs. I hope it was useful. I hope some of you who have restless legs have identified with it. It's particularly important to find in children because they may not express the symptoms because they think it's normal. Most patients with restless legs do think that their symptoms are from a lifestyle thing. Either they've been on their feet all day or they haven't done enough exercise or something like that. It's really important to find. So I hope this podcast was useful for you to identify if you have restless legs or not, to identify if your children have it or not, and that you will take it further and get some help. Thank you very much for listening.
You've been listening to another production from Solid Gold Podcasts.